Hello everyone, my name is Lauren Terrell and I have the honor of serving as the chair of the Institute of Health Economics, at least for another 2 weeks. And then my term is over at the end of this month after 12 years. On behalf of the members of the IHE board, our CEO, Chris McCabe, and the IHE team, it gives me great pleasure to welcome you to the 18th Institute of Health Economics Innovative Forums. These forums began in December of 2008, and they've been very good opportunity to bring people together. They provide a great opportunity for the Alberta health system leaders to gather and learn from international thought leaders and experts. They also provide for a chance for Alberta health leaders to discuss informally how those international lessons might be applied to the health system in Alberta. The IHE has a unique organization that brings together academia, government, healthcare system leaders, the public, and the private sector, together in pursuit of our vision, a healthy population, and a sustained health ecosystem enabled by research, evidence, collaboration, and innovation. The problems we face in healthcare are so challenging and complex, they'll only be solved through collaboration and across the various sectors. We believe that ever since we established the IHE. I am pleased to lead an organization that embodies collaboration sentiment as I firmly believe that good things happen when you bring people together for open discussion. The IHE is pleased to provide these regular opportunities through the innovation forums for the health community to get together and to discuss, debate, and plan for action. We have always tried to select topics that are timely and relevant, and today's theme of realistic medicine fulfills both of these goals. Realistic medicine is a group of concepts which have been promoted by our visiting guest speakers in a series of very important reports in recent years. They quote from a couple of these reports. Realistic medicine puts the person receiving health and care at the center of decision making and encourages a personalized approach to care. It aims of reducing harm and waste, tackling unwarranted variation in healthcare, managing clinical risk, innovating to improve our essential and to a well-functioning and sustainable healthcare system. These ideas certainly resonate with many of the objectives which have been articulated in the healthcare system in Alberta. Before we begin, I would like to ask one of our IHE board members, Justin Reimer, to provide some greetings on behalf of the Government of Alberta. Justin.
Thank you, Lauren, and good afternoon, everyone. I had the pleasure this morning of convening a meeting with Dr. Calderwood and a number of my peers at Alberta Health Executive, including our Deputy Minister Milton Sussman, and we had a great wide-ranging discussion about the efforts that Dr. Calderwood and NHS Scotland is undertaking right now around realistic medicine, and understanding a number of the similarities in our geography, our population, our size of the healthcare system. There's a lot we can learn from her today, and looking forward to her talk. I've been impressed by her efforts to both champion and passionately provide direction and permission to the clinical environment in Scotland to begin behaving in a manner that is consistent with the realistic medicine goals and objectives. And dare I say, we need more of these champions and innovators throughout our system, and many of them exist. We need to provide platforms such as this for us all to learn more from and to garner that wisdom and understand how that might apply to us in the Alberta context. We all know that our health systems are in a series of states of metamorphosis, moving much more to that patient-centric perspective, and that's something that the government is very closely taking to hand in a number of its efforts. That's all going to, in some ways, not culminate, but there will be evidence of that with launch of the personal health care record later this year as a way to enable person-centered care and to enable more information to be spread amongst a broad population towards facilitating many of the goals that realistic medicine is trying to achieve. In Alberta, we have a commitment to community-based care. You've heard our minister talk many times about having the right practitioner at the right time in the right place, working in the system. We've been working actively with our partners through things like wellness supports, disease and injury prevention, and being able to access and share medical records, for instance. As well as working hard with the PCNs and AHS on coordinating service planning and ensuring that communities receive the services where they need most. This is very difficult work and takes a lot of heavy lifting by a number of different people, but it has to be done in collaboration and can't be done by any one independent body alone. So we are making progress on community-based healthcare initiatives. I give you one example that many of you would probably be familiar with, and that's the Community Paramedicine program operating out of AHS, where they built new partnerships between paramedics and palliative, primary, and continuing care, as well as addictions and mental health services. They help improve healthcare outcomes by addressing gaps in the healthcare provisions and reduce repeated emergency calls, emergency department visits, and hospital admissions and readmissions. And we're continuously looking for other ways that we can facilitate community-based care, person-centered care. We're also very interested as a department in working on ways to improve our outcomes and system sustainability by reducing unwarranted treatments through work with our strategic clinical networks, and happy to see Braden here today, and choosing wisely, for example, through the appropriate use of antipsychotics toolkit that was developed a few years back by the SCN. We now have a lower rate of antipsychotic use in long-term care institutions, going to 17.4% versus 21.9% in the province where we were previously, which demonstrates that through new continuum care pathways, demonstrating best practices and facilitating change agency throughout the system, you can improve healthcare outcomes, you can improve healthcare sustainability, and in Alberta we have the unique advantage of doing that on a provincial scale basis. And we need to take advantage of that more. So we're looking to leverage more value-based healthcare principles and practices to improve care outcomes and system sustainability in many different areas. I want to thank the IHE for convening this session. IHE is an excellent partner to Alberta Health and helps to convene some scholarly and world-leading talent to come grace our presence and enable us to learn from it collectively, and to do it as a collaborative so that we can all learn from the experiences of the best practices globally, but then talk with our partners of how do we implement that in our province. So I look forward to a fruitful and stimulating discussion today, and thanks again.